Good evening and welcome to Vax Facts FAQs presented by me, Amiris Robertson, with the National Kidney Foundation of Michigan. A little bit about Vax Facts and Facts. We use this time monthly as a virtual discussion on how to stay healthy and get up to date information on the flu and COVID-19. This month we will do a little pandemic update. So this month we'll actually be talking about the new under 5 recommendation. We'll be talking about boosters. We'll be talking about planning for a safe summer, and we will be talking about resources and, of course, FAQs. Sorry, a little repeat there, 2 agendas. So yes, under 5, booster guidance, actually treatment options, planning for a safe summer, and FAQs. So this past Saturday, on the 18th, there was a change in the overall recommendation. So really who should get a COVID vaccine has been changed to everyone 6 months and older. So the breakdown for that is the authorization for those 6 months to 5 years old is specific to the vaccine manufacturer. So for Pfizer, the age group is 6 months to 4 years old, and the dosing and timing for Pfizer is 3 doses. The second dose given 3 weeks after the first dose, and the third dose given 8 weeks after the second dose. Moderna is 3 months through 5 years old. It's 2 doses, and the second dose is given 4 weeks or 28 days after the first dose. This is as it stands right now, so again, so there's some decision making that has to be done on the parent's part, and it may come down to age, preference, dosing, and timing, but your primary care physician and your pediatrician can work with you to help make that decision and find out what works, what would be best for your family, and what makes you most comfortable. And we just want to revisit why we should vaccinate children, because in the beginning, the guidance was, and the language stressed how COVID really was not affecting children, and how we really stressed vaccinating our elderly and our middle-aged population. We kind of prioritized our older population and worked our way down. But that does not change that children should not get vaccinated from COVID, and it does not mean that there aren't some benefits to vaccinating children from COVID. There are still risks from COVID to children. Children can still get seriously ill, even if the risk is lower for children. Children can still spread the virus to other family members. And vaccination can prevent those things. So vaccination can help protect family members, including siblings who are not eligible for vaccination, or family members who may be at increased risk of getting very, very sick, like those who are immunocompromised. Preventing complications from COVID-19 if they do get infected. And also vaccinating children not only gives parents peace of mind, but it also allows kids to more safely participate in some of the activities that they may have missed out on throughout these last few years. We're going to revisit boosters again, and we'll kind of continue to revisit boosters because a significant portion of the population is still not boosted, even though they are eligible. And for right now, everyone that's 5 years and older is eligible for at least one booster dose. And if you're 50 years or older, or 12 years and older, and have a weakened immune system, you are eligible for a second booster dose. So it's important to get your booster dose because there's evidence that shows that the immune response to COVID wanes over time, and that can lead to reinfection that we do see. And you just want to give your immune system that additional boost so that you can continue to be protected from COVID-19 and get that the most protection that you can against COVID, so that you can be as prepared and as protected at all times, in addition to other protective measures that you can be taking. So if you are eligible and you have not taken or have not gotten your booster, we just want to continue to remind you to consider getting your booster if you are eligible. Next, we want to talk about COVID-19 treatment options. We haven't touched on this in a while, and we just wanted to bring it up again because there are treatment options available should you be infected with COVID and experience mild to severe symptoms from COVID. And the larger reason we want to bring it up is because people may feel wary about COVID-19 vaccines and treatments and look to alternative remedies like dietary supplements and teas to treat the virus. And there is no scientific evidence that these methods prevent or treat COVID-19. Alternatively, the oral tablets, antivirals, and monoclonal antibodies have gone through scientific testing that and the vaccines have gone through scientific testing that have proven to treat or prevent COVID-19. So we just want to encourage you to make sure that you are choosing a treatment option that is right for you and effective. And your physician can really steer you in the right direction to making sure that you are doing so. Another thing when you are looking into these alternative treatments is that dietary supplements can have some interaction with other medications. So that's why it's important if you are taking dietary supplements, even if they are natural, to speak with your physician before you take them. They can interact with your prescription medications. You can be taking dosages that are not recommended for you. So it's still important to consult with your physician before you take these treatments, even though they are natural. And some treatments aren't that are circulating online are not meant for human consumption, and so those are especially important to not consume, and they are especially not meant to treat or prevent COVID-19. So again, there are treatment options that are scientifically proven to treat and prevent COVID-19, including the ones that are on the slide here and the vaccines. So just check with your physician. If you are curious, you can look on the Kidney Foundation's website for information. On the last slide here, we'll have our information to reach out, and you can always look at the CDC for more information. But really, your physician, the CDC, are really good sources to find treatment options that are effective and right for you. But you don't want to take something dangerous and that can interact with medication that could be harmful. We also want to talk about planning for a safe summer, something a little bit lighter. And one way of thinking about it is kind of like sunscreen. You need layers of protection to kind of plan for a safe summer, whether you are planning to go on an airplane, whether you're just going to visit grandma and grandpa in state, or if you're just planning an outing to the beach, anything like that. You just want to add layers of protection to protect yourself, your family, and those in your community from COVID-19. And these layers, they can be things that you have probably been practicing throughout the entire pandemic. But this is just a reminder that you can still be continuing to do these things, even though we're in this weird space with the pandemic, that it might feel that other people aren't doing it, but these layers can still be utilized. So first is, hand washing and hand sanitizing and hygiene. That's one option. Wearing a mask, planning outdoor activities or a well-ventilated area. If it is an indoor activity, that could be kind of hard to um, plan for or to kind of scope out, but an outdoor activity that can really be easy, like barbecue outside instead of being in the house or something like that. Um, and then, of course, vaccination and getting your booster shot if you haven't. Another tool that we kind of talk about a lot is also monitoring your community levels of COVID-19. You can do that on the CDC website. So if your community levels are low, medium, and high, you have different recommendations from the CDC on how to protect yourself. And that can also kind of govern your different layers of protection and what kind of activities you might be doing this summer. So maybe if they're low, maybe you'll do this or that. And maybe if they're high, maybe you might not even invite grandma and grandpa because maybe it might be too high of a risk for them to come or something like that. So it'll help you gauge how much flexibility and help keep anxiety low because you can kind of plan based on what's happening around you in your community. So that's a great tool. So layers of protection, your toolkit, things like that, terms like that is how you can think of planning your summer so that you can participate this summer, unlike a couple summers ago. I think we can do it. I think we can still have a fun summer and a safe summer. Social distancing as much as possible. Still wearing your mask on public transportation, and things like that. So again, there's things you can do to protect yourself and your family and your community, but still have a good time as much as possible. And again, you can always utilize COVID-19 testing and quarantining if you do feel like you have come down with symptoms. All right, so we're going to get into a few frequently asked questions. First question is, why should people get vaccinated if most people have had COVID-19? So there's a couple ways to look at this question. So the first way is like natural immunity, right? I have natural immunity. I don't need to get vaccinated. So the thing with natural immunity is we don't know, or the strength of natural immunity versus the strength of the immunity you get from the vaccine, it's a little bit stronger. And you don't have to go through the potential side effects of COVID-19. You never know how COVID-19 is going to affect you. When I had COVID, I lost my sense of taste and smell. I had a very sore throat. I did not have, no symptoms. I didn't go back to work in a couple of days. Like it was not an easy breezy experience. It wasn't just like a regular cold. I felt really sick. So I would have rather just had, well, I would say I feel like I had a milder experience with the vaccine than I would have if I didn't have the vaccine. So I would want that versus not having the vaccine and saying, oh, well, now I have natural immunity. I don't think that, I think it's just less hardship to get it this way. And then on top of that, it wanes over time either way. That's the best way I can put it. And then another lens to look at it is are they working if people are still getting infected, reinfected? And the thing with that is, one, again, your immune response to it wanes over time, but then also you sorry. Sorry, there's a little bit of a storm here, so my Wi-Fi is cutting out a little bit. So I'm just going to move on to the next question. Okay, so should I still be concerned about COVID-19? Yes, so COVID-19 is in a weird spot. I think it's okay to say that we're in a better spot than we are in the Omicron variant wave that we had. That was a time where there was a lot of cases of infection, and it seemed like it was never going to come back down. Now that it has come back down, and different guidances have been uplifted, and different private companies are changing their guidances. For example, airplanes not requiring that you wear masks on their aircrafts anymore. It may feel like you don't have to be concerned. However, again, the infection is still real. So you can still get very sick. You can still miss time off work. You can still not feel well. You can still have the risk of long COVID. You can still have the risk of serious complications from COVID. So that's why there's still this push and this urgency from organizations like the Kidney Foundation to get vaccinated. We're not going to let up because the risk is still there, even though we're not scrambling, and even though the numbers aren't crazy anymore, there's still the risk, especially if you're immunocompromised or if you live with someone who's immunocompromised. There's people that are immunocompromised in your community. The risk is still out there. So you should still be aware that it is occurring in your community and that the risk is still out there for you. So if you aren't vaccinated, if you're not boosted, if you're not monitoring community levels, when you're I think your awareness could be increased. I don't want people to go back to back to pandemic fatigue or having increased anxiety again, but there can be an awareness that can be managed so that people can still be safe and protected from COVID-19. So how do I talk to people about getting vaccinated or boosted? So when you are wanting to talk to people about getting vaccinated or boosted, it's important to use a model that works for you. A model that I like is from an org called Made to Save. It's their TEO method, which is to build trust, express empathy, and to help them find their own reason for getting vaccinated. So to build trust in getting vaccinated, really you have to, excuse me, you have to want to understand someone's perspective on why they're at where they're at. Oh, I'm sorry. I just saw this question from Amy. Let me see. How can you be comfortable telling someone with kidney issues that it's okay to get the vaccine? I think I might be answering the question right now. Let me see if this will help you. I'm not sure if I understand your question, Amy Stevenson, but let me see if I can try to explain here. So when you are trying to encourage someone to get vaccinated, you want to try to understand where they're coming from and want to express an understanding and listen to understand and not to respond, and to share values with them, and maybe even share your own vaccine story and really try to connect with them to build your trust with them. And then to express empathy is to really just not be judgmental. Everyone has their why, everyone has their story, and everyone has their concerns. And there's a reason behind their concerns. And so just try to be non-judgmental and compassionate when it comes to that. And if they're nervous, try to understand those nerves and connect with that. And then help them understand why they might want to get vaccinated on their own terms without pushing your own agenda for why you want them to get vaccinated. Whether you're a public health professional, so you want all people to get vaccinated because you think it's best for the greater good. But they might be looking at their individual health, and they have concerns about their individual health conditions, etc. So again, you have to bring it back to them and to the individual and help them make the decisions for themselves. So that's really the best way to talk to people about how they might get vaccinated or get boosted. I hope I answered your question, Amy. I don't really understand your question, but if they are if you're unsure about the vaccine and you're not really sure if it's okay, then I would just point them to more information or credible source. You don't have to be the know-all, be-all when it comes to information. I don't know everything. I'm not a scientist, so if I don't know, then I just point to someone who might know or the best credible source that I think is out there. So if you have someone with kidney issues and they might be interested in getting vaccinated, you could point them to the Kidney Foundation. There's a web page for kidney disease and COVID-19 on the CDC website, and those are some tools that I can offer you when you're unsure, but you still want to be a messenger when it comes to the vaccine. Okay, where do I receive COVID-19 treatments? So this question goes to when we were talking about those alternative and natural treatments. So if you're looking to receive those treatments that like the oral tablets, the monoclonal antibodies, those you will typically get from your primary care physician. There are test to treat locations. So if you are someone who is at risk for complications and you come down with symptoms of COVID-19, you could go to these test to treat locations and you can test at the location. And if you test positive, you can begin treatment at that location. So there are options to receive treatments. But again, you can just receive treatments from your primary care physician, but it depends on the risk that you are for complications. So you would want to be in contact with your primary care physician or your physician team or your care team for those treatments to make sure that it's the best choice for you and to make sure that you're eligible. And if you have any questions, feel free to put them in the different comment section, whether you're on Facebook or on YouTube. And I just wanted to leave a couple resources. The first resource is vaccines.gov. So vaccines.gov is a where you can locate a vaccine or booster provider near you. So that is one resource that I can provide you. And that will, you can do that by location. So that's one. And then the other is covid.gov/tests. So that is the other, and that's where you can order your home COVID-19 tests. And I believe if you've ordered the last go around, you can now order more. And I believe they increased the number. I believe it's 6 or 8 now. I forget how many, but you can order more per household this time around. So if you did order last time, you can order again. So yeah, if there's no more questions, I would like to say thank you for logging on with us, and we would appreciate any feedback that you may have. Um, and if you're interested in our next live stream, you could register at nkfm.org/COVID-19. That link is also our information page for a lot of our COVID-19 information. If you scroll down past the NKF, um, the Vax Facts and Facts information. If you have questions, you can reach out to reach@nkfm.org. And I hope you have a great rest of your night. And again, please reach out if you have any questions. And thanks for logging on.